Moani Kiela, thank you. Well, 207,000 people every year, 1 in 8 women over the course of their lifetime. Odds are you or someone you know has battled breast cancer. Now, the death rate for breast cancer has been dropping since 1990, largely because of early detection and public awareness. But experts say much more needs to be done. One woman who knows the importance of all of this is Nancy Brinker, the sister of Susan G. Komen and CEO of Susan G. Komen for the Cure. And joining us live from Dallas this morning, courtesy Susan G. Komen for the Cure, is Nancy Brinker. Aloha, Nancy.
Aloha. How are you today?
Oh, we're great. We're so happy to have you on our broadcast this morning.
Great.
I have to ask you,
Great to be
huge
here.
strides have been made toward breast cancer awareness thanks to organizations like Komen, but experts say less than half of women aged 40 plus with health insurance are getting annual mammograms. So why is that?
Well, there's a confusion of messaging, first of all, and people need to understand that screening does save lives. They may not be, a screening procedure is not a cure, but people, they're effective over 80% of the time, and the 5-year survival rate from very early breast cancer has increased from 74% when we started our work over 30 years ago to 98% today. And a lot of that is due to screening and the early detection of early breast cancer. That's why it's so important. So people who have health insurance should just make it a part of their normal, well-woman sort of behavior, their health behavior. And, we're very concerned about this because we want to make sure that people survive. And the best way to survive a diagnosis of breast cancer is finding it early.
And we know that this cause is so deeply personal for you. And of course, pink is breast cancer awareness. We see it behind you. We're seeing lots of it now.
Right.
What's your plan for moving the public past the awareness stage toward meaningful results in your personal battle?
Well, we're already meeting a lot of personal goals, and that we now understand the biology of cancer. We now are beginning to, through the research that we fund, tailor personalized therapies, because breast cancer is really many diseases, not just one. And then we're also becoming expert at translating what we know from the laboratory into every culture of our country and every pocket, no matter how dark and deep it might be or how low resource, to understand how to treat people with no care at all so that they can survive this disease. Our goal is to, in the short term, is to make breast cancer a disease that people can live with for a very long time. And in the long term, of course, we'd like to make sure we could learn how to prevent it.
And Nancy, really quickly, how frequently should women schedule those checkups?
Well, we've never changed our recommendations. We're saying that somewhere around the age of 40, a woman should have her first baseline study. And then yearly or every 18 months or whatever, in consultation with her physician, should decide how often to get one. And again, there are recommendations and discussion of all this at Komen, KOMEN.org, the website of our organization. And it's really important that people understand the issues, and we have an endless amount of resource on that website.
Well, Nancy Brinker, thank you so much for joining us. KITV is a proud supporter of all of this, so we appreciate your efforts. Well, you still have a chance to help.
And thank you what you're doing.
Oh, thank you. And you still have a chance to help the cause. So it is on Sunday, October 16th, the Komen Race for the Cure takes over Honolulu. And you can still register online by heading to the homepage of our website, KITV.com. Just look for that at the top of the page under the Hot Topics section. And once you're there, you'll find a wealth of resources, including breast cancer myths and powerful stories of survival. It is all about pink. It is 5:47. We'll be right back.